in this abstract presented by Tizona, they reported on a couple hundred patients of stage 1 to 3 colon cancer who were followed with circulating tumor DNA by the Natera test. And that test actually takes the tissue from the tumor and kind of makes a custom PCR assay that includes the mutations we looked at for advanced disease, but also mutations at high frequency in other parts of the DNA that may be more silent for other purposes. So it's a very specific and sensitive test. So they looked at the post-operative course for the people who were positive after having had the resection and one test afterwards. About 10% of the patients were ctDNA positive, and the hazard ratio for recurrence was 14. So that if you were ctDNA positive, they mostly recurred, like 90% recurred, and if you were ctDNA negative, about 90% didn't recur. And they also did some extra analyses looking at post all therapy. The hazard ratio on that was 48 with serial sequence sampling, and post adjuvant chemotherapy where the hazard ratio was 28. So if you had a high risk stage 3 and you got adjuvant chemo and you're ctDNA negative, you have a high cure rate. But if you're ctDNA positive, the chances of you relapsing are also quite high. So this is going to kind of, I think, become the new approach to adjuvant therapy of colon cancer, that we're really going to be using these tests in the future to help us decide who's got persistent disease. If you're ctDNA positive, it's not really like an adjuvant therapy risk calculation. It's like the disease is still there. We just can't detect it by other means. It's like minimal residual disease with hematologic malignancies. Our 80 to 90% it's going to come back. So what can we do for those patients? That'll be kind of the next stage of adjuvant therapy in the future, I think. And for lower risk patients who are ctDNA negative, we should be able to probably skip therapy for some of them.